Quack, 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 quack.
Ribbit, ribbit, ribbit.
Quack, quack, quack.
Ribbit, ribbit, ribbit. I'm in love with a big blue frog. A big blue frog loves me. It's not as bad as it appears.
But it's not actual Susie.
Quack, quack. Ribbit, ribbit, ribbit. Quack, quack.
Ribbit, ribbit,
Go to the garden, to the garden.
Take 8.
Quack, quack.
Please.
Quack, quack.
ribbit, ribbit. Well, I'm in love with a big blue frog.
Waiting.
Blue
1.
frog loves me.
Wow, I knew that's going to happen. It's hot. All right, let's take another break. Okay.
Tomato 80. Shiny, the patient is here. In countryside. And I tell you, the wall mechanic. It's for perfectly on you, see. Ready for a handcuff? We just have a doctor. It's pirate smile on this and well played exactly especially with a doctor. It's especially with a doctor. You're going to go to your hospital. Please go to the hospital. I go to hospital. What do you want to go to hospital? East 8 or go to hospital. This is Massaw.com. I'll go away and read something.
Nice day for a walk in the park.
Would you know what to do if someone suddenly collapsed in front of you? Helping to save a life may be easier than you think. If you see a
It got
teen
to
or an adult
be
suddenly
hurt.
collapse, it's important to respond fast.
Huh?
Running away and ignoring it is not an answer.
Now they ran away too fast, so not away.
Here's the sequence to respond to a sudden cardiac arrest collapse.
Fine.
As with all first aid situations, you need to assess the risk to your personal safety first, and the safety of the casualty second. To respond to a collapse, it's important to respond fast. Running away and ignoring it is casualty second. If the victim appears unconscious, shake or tap the victim's shoulders and shout,
And get to the sweet music. I don't want to go to sleep and get to the
if we
sweet
get no
music.
response, the victim is unconscious, and we send for
I don't
help.
want
Call
the
an
sweet
ambulance.
music and get to the sweet music.
Get the AED.
Open the victim's air.
I'll go to sleep and get to the sweet
Away
music.
by tilting their head back
We
and
want
lifting
you.
their chin. If the victim is not breathing or even gasping, start chest compressions right away. When the AED arrives, allow your second rescuer to prepare the AED while you continue compressions. And follow the instructions from the AED when it's ready.
Unit OK. Stay calm.
Stay calm.
Check responsiveness.
Continue compressions. And follow the instructions from the AED when it's ready.
Unit OK. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest.
Remember to remove the victim's clothes to expose his or her bare chest before attaching the electrode pads. Tear open the electrode pack and unfold the electrode pads. Once the pads are applied, the AED will automatically analyze the victim's heart rhythm. You should not touch the victim at this point.
Shock advised.
The AED will advise you.
Shock advised.
Does that tool hurt?
Analyze the victim's heart rhythm. You should not touch the victim at this point.
Shock advised.
Does that tool hurt?
The AED will advise you to perform
No,
CPR
keep going.
immediately.
Push harder.
Ooh, make sure pay attention
Good
to each one
compression.
goes. Good heartbeat, just.
Continue compression.
Continue CPR and using the AED, following its instructions until
Oh, save the
help
ambulance.
arrives. Your actions can help save a life, including
so
the
sick.
life of someone you know.
Oh, see me, heartbeat.
Hey, knock it off! Quit shoving!
They're gonna wreck the field. Still, I'm still the same. Choose one.
Whoa! You're slipping! Stay down. I've got a race to win.
Behind you!
Hey, back up, boat brain!
Ow! Quit shoving.
My sheep! Watch was angry. You're not mad. This car crash. Heartbeats. Just how it's the SEIA.
It's so sad that Flower's on life support.
Try something poetic instead.
I know how to lift Flower's spirits. Either a clap or a flower power dance.
Ratfly wants to show power. Want to show the power of? Ratfly wants to show the power of? Two. Go see me. Let's show the power of two. Change me.
Easy, boy. But what about Gary then? If he doesn't have a disease,
He's got a little splinter in his foot.
I knew you were disease.
Neatly lost. Oh, easy. Well, it's time to cut.
Ain't you?
What's that? The heavenly light.
You're not hungry?
Let's see if I get this thing.
You're not hungry?
Faster, Gary! Faster, 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 faster!
Oh! Out! Make that!
Faster, Gary! Faster, 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 faster!
Oh! Looks like number 7 has a...
Here's the grabby thing. I see me.
Hello, I'd like to tell you about... Oh, didn't expect that.
Hey, sudden cardiac arrest occurs when the heart stops beating properly. Sudden cardiac arrest is an electrical problem caused by an abnormality in the heart's electrical system. The heart's pumping action is disrupted, and the heart can't pump blood to the brain, lungs, and other organs. Seconds later, the victim collapses suddenly, appears lifeless, and is not breathing, or is abnormally through Cardiac strike those with no history of heart problems at all and can be caused by recreational drug use, electrocution, or even a sudden blow to the chest. Sudden cardiac arrest strike those with no history of heart problems at all and can be caused by recreational drug use, electrocution, or even a sudden blow to the chest. Sudden cardiac arrest same as a heart attack. Think of a heart attack as a plumbing problem.
Remove pad package. Stop CPR. Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button. Shock delivered. Start CPR. Push to match the tone. Patient. Analyzing. Shock will be delivered in 3, 2, 1. Shock delivered. Adult pads. Unit okay. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Don't touch patient. Analyzing. Don't touch patient. Analyzing. No shock advised. Start CPR. Push harder. Push harder. Good compressions. Stop CPR. Don't touch patient. Analyzing. Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button. Shock delivered. Start CPR.
A sudden cardiac arrest can happen to anyone at any age at any time.
Anthony, are you okay?
You're right.
Anthony, are you okay? Anthony, are you okay? Can you hear me?
Look at the AED.
Call emergency services.
Responding calmly, calling emergency services, and immediately starting CPR is critical to the victim's outcome.
My coworker's unresponsive. Yeah, we're located at 523 Main Street. They say start the CPR.
Every second counts, since the chance of survival in cardiac arrest drops by 10% every minute you do not perform CPR.
The AED's arrived.
Having an automatic external defibrillator, or AED, nearby is crucial. Since every second counts, you should ideally have an AED located within approximately 3 minutes of every location within a building.
Unit okay. calm.
In addition, a Zoll AED will guide even the untrained rescuer through proper CPR.
Check responsiveness.
It will also advise you if and when a shock is necessary.
Call for help.
You're on the way.
Open airway.
The AED-3 was designed for anyone to help save a life even without training.
Check breathing.
It is that easy to use. It guides the rescuer through every step.
He's not breathing.
Adult patient selected. If patient is a child, press child button. Remove pad package.
The latest guidelines suggest trained rescuers active.
Cut or tear clothing. Don't touch patient. Analyzing. Shock will be delivered in 3, 2, 1. Patient. Analyzing. Don't touch patient. Analyzing. Shock will be delivered in 3, 2, 1. Shock delivered. Patient. Analyzing. Don't touch patient. Analyzing. Shock will be delivered in 3, 2, 1. Shock delivered. Patient. Analyzing. Don't touch patient. Analyzing. Shock will be delivered in 3, 2, 1. Patient. Analyzing. Don't touch patient. Analyzing. Shock will be delivered in 3, 2, 1. Shock patient. Analyzing. Don't touch patient. Analyzing. Shock will be delivered in 3, 2, 1. Patient. Analyzing. Don't touch patient. Analyzing.
A save station houses an automated external defibrillator, or AED, that is for anyone to use. In the event of an emergency, it's important we all understand what to do until medical help arrives, because every second matters.
Zach, are you okay? Zach, can you hear me? Can you hear me? Zach,
Oh, 911.
can you go call 911, tell them we have an unconscious male, and report back to me once you're done?
Yes.
Perfect, thank you. Kate, can you go grab the AED from the safe station? Do you know where it is?
Yes.
Bring it back to me once you get it.
Unusual breathing, or gasping, is common during sudden cardiac arrest. This is called agonal breathing. If someone is not breathing normally, you need to begin CPR immediately.
Unit okay. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Don't touch patient. Analyzing.
This device can perform ECG monitoring through 3, 5, and 12-lead ECG patient cables. ECG monitoring can be done with both therapy electrodes and ECG electrodes. Connect the ECG cable to the input connector on the left side of the device. To access 12-lead ECG setup and monitoring, press the 12-lead quick access key. You can utilize the 12-lead quick access key to take a snapshot of the current ECG, to enter patient information, to review a snapshot, to change the display screen, or to exit the 12-lead and return to the home screen. This device will allow you to select the waveform trace size in order to adjust the size of the displayed ECG waveform. To select the waveform sizes, use the navigation keys to highlight and select the trace size that appears to the right of the electrode label. The default trace size is 1 centimeter per millivolt. You can select a larger or smaller size. You may also select Auto, which displays the best fit size of the trace. Once you have prepared your patient for 12-lead ECG monitoring, you can print the 12-lead ECG for review and analysis by simply pressing the Acquire Quick Access key to collect 10 seconds of 12-lead data for print. Pressing the Lead Select Quick Access key will toggle through all available ECG leads for primary monitoring leads. Use the navigation keys to highlight the lead indicator for any monitoring lead and press the Select key. A drop-down box will appear, giving the provider a list of all available options for monitoring functions. This option also provides the ability to insert, remove, or cascade tracings to customize the display. You can enable up to 4 waveforms on the display. The first waveform at the top of the display is always an ECG waveform. To change the lead size, using navigation keys, highlight the size indicator and hit the Select button. A drop-down box will appear showing all of the size options available. Scroll up or down using the navigation keys and use the Select button to select the desired option. To obtain a 12-lead ECG, simply press the 12-lead Quick Access button and it brings you to the 12-lead menu. The first thing you notice is the 12-lead ECG on the screen. This is a dynamic ECG that allows the rescuer to recognize artifact or a lead-off condition prior to the acquisition of a 12-lead ECG. Prior to the acquisition, it is important to enter the patient's age and gender. The second Quick Access button allows you to enter the patient's age and gender using the navigation keys. When the 12-lead ECG key is pressed, this view provides the user with a complete clinical snapshot, although you must refer to the printout for a true diagnostic quality reading. To acquire a
Drop into just with the record.
A save station houses an automated external defibrillator, or AED, that is for anyone to use. In the event of an emergency, it's important we all understand what to do until medical help arrives, because every second matters.
Zach, are you okay? Zach, can you hear me? Can you hear me? Zach, can you call 911, tell them we have an unconscious male, and report back to me once you're done?
Yes.
Perfect, thank you. Kate, can you go grab the AED from the save station? Do you know where it is?
Yes.
Bring it back to me once you get it.
Unusual breathing, or gasping, is common during sudden cardiac arrest. This is called agonal breathing. If someone is not breathing normally, you need to begin CPR immediately.
This one's good.
Unit, okay. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest.
They're all over it. It's not even
This isn't just a trend or anything like that. Like, we have changed the way that if it can.
Hot dog, hot
break mouse rules to help rescue Ruby today?
Well, what a hot dog day!
Hot dog, hot diggity dog. It's a brand new day. What you waiting for? Get up, stretch out, stomp on the floor. Hot dog, hot diggity dog. Hot dog, hot diggity dog. We're splitting the scene. We're full of beats. So long for now from Mickey Mouse.
That's me!
And the Mickey Mouse.
Aw, thanks for stopping. Now, okay, that's what all these haunted characters come to a patient when they come in 3 seconds. When it's done. Now turn on AED modes and count phone attacks in progress. It can be burned with the AED CPR tool. Copyright 2018. It's web on Disney generation.